Fabulous. Okay, thanks again and welcome for our people who we're recording for. We have a poll, but I think we're going to skip that because we've got such a small group here today, and we'll just move on to the more important information about the event. So if you take a look online at the event agenda, which is on the event website, you can see all the sessions that will be taking place. It's a nice idea if you have time before the conference actually starts to identify the sessions that you're most interested in attending. Special note, everything is posted in Central Time as a default. You have the opportunity to change the time zone so it's more convenient for you. And that happens right on the agenda tab of the website. Also, one other special note, as we say on here, because of special requirements for the social workers and psychologists, those sessions are noted on the agenda and on an updated final program PDF that I'll be sending out after this program takes place. But you can only get CE credit for the sessions that are noted if you are one of those two categories, general certificate, medical, and nurses. You can attend any session that you're interested in. If you'd like to have those presentations in front of you to make notes on or to follow along on a second monitor, everything that we have received, which should be everything, is available in your my.ncchc.org account. And you can just log in, and on the left, it has conference proceedings. You will see the virtual spring conference, and you can download all the sessions that you're interested in there. Most important before the session starts is to please test your system. There's so much security in our field, and a lot of places have very limited internet access. One thing that helps is to use Chrome as your browser. Use a regular computer, not a telephone or a cell phone, and do try the test session before the session starts. If you're having a problem accessing the video or hearing it, it is a firewall issue on your end. The program is working. So please check with your IT department, and you shouldn't have any additional problems accessing the content. The way the program works is that all of the content is recorded in advance to make sure that we don't have any technical problems the day of the conference. So if you can get to the test session, you should be able to get to the recordings. You'll be able to interface with the other attendees and with the instructor through the text chat that will be located on the right side of the screen. When you log in, you will have received this. Everybody outside of the last 3 people who registered this afternoon have received your login credentials. So if you haven't received them or can't find them in your inbox, please do contact us at education@ncchc.org. And you will go to the live event tab and click there, and you will see a sign-in panel. And you will want to use the same, I'm sorry, it's not the, it is this, not the same password you registered with. It is not the same as your my.ncchc.org account. You should enter your, hit that button that says, don't know your password, please click here to reset it. That will send you an email, and that will allow you to set your password for this platform. This platform is separate from the regular NCCHC system. So again, just because that slide isn't clear, when you try to log in under live event, which you can do today, click that reset password option. It will send you an email, you'll reset your password, and then you'll be able to come into the live event. The live event platform looks like this. Every session will actually open at the time shown on the agenda. So if it starts at 10, all 3 sessions that start at 10 will be available to you at 10 Central Time on Wednesday. And you'll just click view session and you'll walk into the session as though it's a session at a conference. If you come in 10 minutes late, you come in 10 minutes late, and you can that way keep up with everybody else if there are comments or questions for the instructor. Once the 11:30 session starts, you can watch any of the 11:30 sessions or the 10 o'clock sessions because they will now stay open through June 20th. So the conference will gradually open all the sessions, and by the end of the second day, everything will be available to you. You can switch from session to session. You can have multiple windows open. It's completely up to you. People usually have questions on obtaining their CE, and it is very easy, just like one of our regular webinars or conferences. After the conference, go to your profile in my.ncchc.org and click on Claim My CE Credit, and that will ask you a series of questions. You answer the questions, and then you can print out your certificate or save it to your computer. Please wait to print your CE certificate until you've watched all the presentations and you've done all the submissions in the portal, because otherwise you're done and the portal thinks you're finished and you can't go back. So you can save as you're going and just don't hit that final submit button until you're actually ready to claim your credit. And remember, there are special requirements for NASW. They only allow the 12 credits. Psychology only allows most of these sessions, about 22 out of the 24 sessions, and everybody else can attend all the sessions that are in the platform. So please take your time and really get as much learning and education out of the conference as you can. That is it on this section. I can't see the questions. Rick, are you in the chat at all?
Yeah, so Rebecca has a question, Kim, asking will the password carry forward to other events under the platform?
Yes, it will, actually. So if you were at any of the past NCCHC conferences in the last 2 years that uses this platform, it's the same password and you can use it going forward. And if you don't remember it, you can reset it.
Cool.
Great. I will, of course, stay on and I'll be monitoring the chat as Rich starts to make his presentation. Although I'm watching the presenter mode, so it is hard to see the chat, but now I can do that. And Rich, I will turn it over to you to talk about NCCHC.
All right, sounds good. Thanks, Kim. All right, so everybody that's not familiar with NCCHC and our origins, we started with the American Medical Association back in the very early 1970s, in conjunction with the American Bar for the medical and legal sides in Chicago. That's where both their main headquarters are at. They did a nationwide study and found that jails were generally inadequate, disorganized as far as the provision of health services, and that there was a lack of national standards to really govern how those services are provided. So everybody's very familiar, obviously, with Estelle v. Gamble working in corrections. That's your landmark case to the Supreme Court, where it established the right to access care, the right to receive health care, and professional medical judgment. So what the reality is, American Medical Association, American Bar were working on this issue years before that ruling actually came out. 1976, the initial standards had actually already been developed for NC. They eventually became the NCCHC standards, but they were initially standards under the American Medical Association, who remains involved with our governing board today. Today, we have about 32 different organizations that collaborate in part overseeing our entire operation. And of course, NCCHC came into existence in 1983 as a not-for-profit that spun off of the American Medical Association. So our roots are actually in the American Medical Association, if you didn't know that, and that's where everything came from to bring us to the organization we are today. And Kim, I don't have control of the slides. I think you know that. So, okay.
Oh, yeah.
Thanks. Thank you. All right. So we have different programs. I'm the vice president of program development, so I do business development for NCCHC. So I basically delve into all areas of our organization. I'm also a surveyor and go out into the field in facilities doing accreditation surveys, and I work for NRI doing our consulting. So this is a brief overview of our NCCHC programs. You have our standards for healthcare, health services, which are our foundation for every service we do. And that's your benchmarks, the acceptable level of care and constitutional level care in correctional facilities, prisons, jails, and juvenile. We have a professional certification program. Many of you are probably CCHPs already, so you're familiar with that. We have our accreditation programs. NCCHC Resources is our consulting affiliate. They're a separate not-for-profit, but they do consulting. They work in a silo separately from accreditation, where when they're doing technical assistance, whether it's in-custody death reviews, accreditation prep, they do not communicate directly with accreditation at all. That's to ensure there's a fair and objective accreditation process done if you do pursue accreditation. Foundation is our third not-for-profit. They are external. We're behind the walls with the other programs. Foundation is actually out in the community and dealing with the correctional healthcare professionals, and the reentry community as well has been a focus. You may be familiar with them. They provide education and scholarships for people to attend our conferences and to receive other access to other events. We just had a recent one they're doing. They're involved with the CCHP program where we're doing a scholarship program. The application's just closed for that. And then education and conferences, we're being part of that now, but throughout the year, we'll do our webinars or conferences in person and virtual. And we also offer other educational topics as part of our services.
I will jump in and say that there is a scholarship application portal open right now for our national conference in Las Vegas. And if you're interested, you can just check our website on our blog post near the bottom of the homepage. But that portal will be open until mid-June. And if you are in the field for 3 years or less, or a student, you are eligible to apply for that scholarship. And that will cover airfare, hotel, and registration fees for the event.
Thanks for the reminder on that, Kim. I didn't realize we opened it already, so I appreciate it.
Sure.
All right, so talking about our NCCHC standards, everybody's familiar. We do have different programs than the standards. We'll go into that in the next slide, but this is our foundation for everything our organization does, as I mentioned. We do have our different programs for jail specific, prison specific. Mental health services applies to all facilities in a supplement to the other standards, but it is its own standalone program as far as an accreditation program. And then our opiate treatment program, OTP accreditation, and MAP accreditations are done in conjunction with SAMHSA, and they're also in line with the jail and prison standards as well, but it is a standalone program. The last program, our 5th program, is for juveniles. It's the most recently updated accreditation manual. And everybody asked this stuff. I'll just kind of put it out to the small group here, is there are updates coming to our accreditation standards for all the programs over the next year. So you'll be seeing those come out.
Well, I would say in 2025.
Well, yeah, the next year. Yeah, over the next year, year and a half.
Not
yes.
this year.
No, within the next year from now. Yeah, so we're going into 2025 for sure. All right, then for more information, you can email our info address. That's our generic address. You can also go to our website. The links are there. And then we have other helpful information. You will get copies of this presentation, but it has our bookstore where our position statements are. I talked about education. We have several different things. Position statements, educational conferences, pre-conference seminars like this one you're attending, other webinars, and you do get the CEUs for those that continuing education credits for attending those. It will specify in each class what the credits are for and how long, and then our position statements and our journal of correctional health. So the 5 individual accreditations I talked about. We can go to the next one, Kim.
Sure.
Thanks. And then actual accreditation. So we don't have our poll set up, but does anybody here, is your facility accredited that you work in? Yes, no? Yep, I see a bunch of thumbs up, hands up, heads nodding. Awesome, that's great. As you know, you're recognizing and confirming that you meet national standards, that constitutional level of care, and being involved with those standards, being involved with the facilities, you know, it helps verify and helps promote that efficient, well-managed healthcare system that's organized. You have the collaboration across custody and medical staff as well. And of course, if you have separate mental health or other services, it's not all under the same umbrella. Everybody's basically combined under these standards that bring everybody together. And one of the big things, I'm a former jail commander. I come from the custody side. I did 25 years in Vegas. And I've lived through this. I've actually been in that jail commander seat, is the reducing the risk of the legal judgments and liability. And that's absolutely something I've experienced as a jail commander, where the fact we were accredited, my whole career, we were accredited, very fortunate for that. And several lawsuits we had that were basically frivolous and throwing out allegations. Anybody can file a lawsuit, of course. The fact we were accredited helped us greatly in getting summary judgment on those cases. So, and that's pretty much the experience across the country. We do talk about the Pinnacle Award for those of you in accredited facilities. So there, I mentioned the 3 different programs. You have the juvenile, but there's the OTP, the mental health, and then you have the prisoner jails. If you're accredited in the mental health, the opioid treatment, and the health services, you receive the Pinnacle Award. We have a few facilities that have all of them. We have several other ones right now that are in the process of trying to achieve all 3. And basically, that's the overall accreditation for all the services. If you're providing those comprehensive services and the more drilled down accreditations as far as the mental health. So we always talk about that and kind of throw that out there. We have our accreditation information here. And again, you will be getting the information with the slides. We are also right now, we are looking for surveyors. We're looking for surveyors for our accreditation program that go out into the field and do the accreditations in other facilities. We are looking for general surveyors. I'm a general surveyor coming from the custody side, but General surveyors can be from pretty much any specialty. Of course, we have our physicians, health services, OTP. We're looking for anybody, mental health services as well, if you have those specialties. So Wendy's email's up there. Wendy's our director of accreditation. If you contact her, we are looking to recruit for those surveyors and get people trained up so they can help us out. Yeah, please, David, make sure you put in for that. The only restriction, if you work for a vendor, there are some restrictions on the facilities you can go into, just because if they're under another contract, we do give an option to those facilities, whether they want somebody from a competing company potentially coming in there. So it might be a little more limited, but it really depends on the facility to facility. We are cognizant of that and aware of that when we go out and assign people. So
I'm a retired captain from CDCR, and then
outstanding, sir.
Yeah, and so I came back to work for Tulare County Public Health, doing their criminal justice with healthcare access for the inmate population. And so it's different. Tulare County is a little bit different in that public health actually coordinates the contracts and oversight of our vendors rather than the sheriff's office. So we work with the sheriff's office a lot.
Interesting.
Our healthcare access. So yeah, I've always been looking for this opportunity. I know at CDCR we were always accredited with some organization, and I always thought that was an interesting job to be able to go in and be that person.
Yeah, definitely. We need you put in, sir. That'd be outstanding. So
okay, I missed that email address. Is it too late?
No, you'll get a copy of this, but you can also reach out to me. But there it is again. It looks like Kim put it back for you.
And David, I wrote your name down. Don't worry.
We are heavily recruiting, so this is perfect. That's great.
Thank you.
All right, you bet. Thank you. Appreciate it. All right, so professional certification, the CCHP program. This is our professional certification program for recognizing your mastery and knowledge of the standards. We have a lot of CCHPs, obviously, that work in accredited facilities. Who's all CCHP here on the call? All right, I see a few of you. So professional certification is just a reaffirmation that you understand and you are a master with those standards. And we can go to the next slide. That's fine. So the program itself was established in 1990. It was the first one of its kind dealing with correction-specific healthcare. It's the largest. It still remains the largest program in the world. We have over 4,000 individuals who are individually certified. And as I mentioned, it's showing that mastery standard. Some facilities, some organizations require it for their administrators. When you get certain levels and supervisory roles. One of the underutilized areas is from the custody side. I come from the custody side. I am a CCHP. It is underutilized on the custody side as well, because that really does help foster that understanding and teamwork as well, having that certification and understanding the whys behind the accreditation standards and the accreditation itself. So it's something we've really been pushing. We're going to be developing an article for that. One of my peers and I pretty soon, just discussing that and trying to expand that knowledge of it. We did have a new program start last year, the CCHP CP, and that's a specialized one. I'm going to go into the specialized ones in a minute, but that's been expanded beyond just doctors to clinical providers. So you have your mid-level providers that are also included now, with your physicians, NPs, and your PAs that are actually eligible for that. So how the program works is if you do have a specialty, if you wanted to get one of the RN, we can go to the next slide, Kim, the specialties. If you wanted to get the RN as an example, because you're a registered nurse, you do have to become a CCHP first, achieve that, pass it, and then you would test for the specialty certification on top of that. The only one you really have to wait for is the advanced. To be a CCHP advanced, you have to have 3 years as a CCHP, 3 complete years as a CCHP before you can test for the advanced. It's more of an essay and a written product for that testing process for those that have done it. And if you're interested in that, you can always contact us so we can get you more info. We'll have a slide here coming up with the contact information on that. And there's you can reach out to me as well. I can get a lot of information on that. It's been very popular lately. We've had a lot of demand lately for the certification coming up. So, all right, moving forward, education and meetings. Our conferences, basically, we do 3 in-person conferences a year. If you've who's attended an NCCHC conference before? I see one. We're there all the time, right? So the big ones are national conference. That's in October. We just did our spring conference this year. It was in St. Louis. That's a little bit smaller, a little more intimate. And then we have a mental health specific conference that goes in July. So this year in July, we're going to be in Puerto Rico. The national conference will be back in Las Vegas again this year. Some more information on that.
I thought I had the upcoming dates, but I didn't.
Yeah, you do. It was the one after the survey. Yeah, I saw it on there. Yeah.
Sorry.
Yeah, that's okay. Yeah, so we'll have the dates come up here, because I don't think we're going to do the survey, right, Kim?
Yeah, we can see.
Since we kind of did a hands up already.
Yeah, there we go.
Right, and there's the dates that are coming up. We do have we have a virtual mental health as well. Kind of like this one's following our spring conference. We have a virtual mental health conference that will also follow the mental health conference. So those are both options for those of you looking for your training hours and looking to get involved with the topics. And then education and email, education's emails up there, our recorded webinar links there as well. You will get a copy of all this and be able to look at that. All right, and I mentioned the foundation earlier being our third arm of the organization. So it's a separate not-for-profit. So the mission, again, Kim had discussed one of the scholarship programs we have that just opened up for the national conference. But basically their mission is championing that health field, the correctional health field, serving the public, supporting research, professional education, scholarships, patient reentry. Patient reentry is a new focus, and we're getting our feet wet with that and delving into that. But we also recognize, especially with me coming from the custody side, it's a common concern you share with your medical peers is that we provide a very high, I would argue we provide a very high level of care in most of our facilities, right? Especially if you're accredited. And biggest challenge is that continuation of care. Once somebody gets out, you put a lot of work into getting folks stable, you get them on their medications, you get them stabilized. And then if the community is not really supporting that care and not providing that follow-up treatment, it's very difficult. And you end up having that recidivism cycle where the same folks come in. So this is something, a relatively new focus for us. We're going to be putting a lot more priority into. You'll be seeing coming up. And for information about the foundation, there's their links. They will have a booth at the conference. I think we're doing another silent auction this year, right, Kim? We're going to do some more stuff this year at the national conference.
Yeah, that'll be at National in Las Vegas in October.
Nice. And then lastly, NCCHC Resources is our consulting arm. So they are separate and distinct from accreditation. We still use these standards as the foundation for what they do, but they're a technical consulting services organization for nationwide facilities within the healthcare. We do jails, prisons, juvenile, but we tend to have more jails that reach out to us. And again, we're just doing that same reinforcement of our mission here to improve that quality of care. We're ensuring that constitutional care is being provided and reducing liability. That's primarily what NCCHC Resources gets called in for, is people looking at system performance assessment, death reviews. They're looking at ways to improve suicide prevention programs, or another example. They're looking for ways to improve their services and reduce liability, or potentially they've been experiencing adverse events and they're looking for assistance from a third-party objective organization to come in. We do use our team of experts. We have the same model as our accreditation, where we use primarily, we have a lot of consultants that are experts in the field with different disciplines. And depending on what the client needs, we'll put together that team of experts based on what their challenges are and what they need for that assessment to go. Whether that's mental health, custody, medical, and of course, a doctor is always assigned, as we do with any of our organizations or clients. Some of the sample projects, I didn't mention the RFP development, but we do RFP development and contract development as well to assist with, especially large and complex ones. We have experts in developing those, writing those, reviewing them. So we offer a full breadth of services on that. We also do monitoring ongoing to make sure contract milestones are being met. Sometimes those are written into the contracts, so we actually perform those services as well. The system evaluation I covered, whether it's a readiness for an accreditation, if they're looking to do a first-time accreditation and they're looking for assistance with that, non-emergency health services, but looking at their policies, procedures. Suicide prevention is a big one. In custody deaths are a big one as well. And then training is something else we offer. I know we have our education section I mentioned, but we do interactive training. We do in-person training. For example, we have clients we do CIT programs with, and we'll go out and provide full comprehensive CIT program, training on opioid use disorder and how the processes work. Pretty much anything under the gamut of correctional healthcare we can provide. And then their links are right there. And that's pretty much it. If you have, so we have this link here. If you want to get started, don't know how, I'm always available. I'm the general contact for the organization, and for departments to reach out to or organizations to reach out to. If there's anything you want to just discuss, there's never an obligation to reach out to us and have a Teams meeting or have a teleconference to just kind of discuss challenges and potential options if you're looking for help or you're just looking to talk about trends. Feel free to do that. My link's up there as well. It goes directly to my calendar, so you can just set a time at your convenience and pop up a meeting with me, and we can get together on a teleconference or phone call and talk about any needs or concerns you have. All right. And then we have our free copy of the slides right there on the link as well. I like that one, Kim. I love free stuff.
I know. We have one poll we're going to do. Just make sure we're meeting your needs. And let us know if this is what you expected to hear. And if there's anything else you would have liked to know, you could just put that in the comments.
I'm going to be
And
biased and say very useful. I get to vote. So
you excellent, excellent. So thank you. So far, we're hitting the high points, I think. So that's awesome. Great. And then I think that is basically the end. There's our contact information on there. And we will be reaching out to you after the event with these slides. And let's see, I'll just stop the share.
I see Trista's question. I saw you answer the one about the preparation for the exam, Kim. So, but there's one about opening up the LPNs. I have not heard anything on that, Trista, as far as expanding the program beyond the RNG yet. But there's always things we're looking at with that. So I'll run that up to Matisse's team and let them know that was a question. I think we've had some other requests about that as well.
Yeah. Any other questions on accessing the platform? Everybody got their login information and you're ready to go? Cool.
What a bummer. Sorry you can't make the conference either, Trista. That's tough on the timing on that.
Yeah.
That is true. That flu season hits right around that time. It's a tough time.
Great. All right. We will let you get back to your busy day. We'll hang out here a few more minutes. If anybody wants to talk more quietly, that's cool. And thank you so much. And we'll see you online on Wednesday.
Thanks, everybody. Enjoy the conference. Take care. David, look forward to hearing from you.
Thank you so much, Richard. I'm looking forward to reaching out.
All right, bro. Take care. Be safe.
See you soon. Bye-bye.
Bye.
I just had a quick question because I don't remember receiving a separate login email. Was there an additional one that was sent out?
I just sent them out starting on Friday. And then if you registered since Friday, I sent them out. I've been sending them out today. So if you didn't see it Friday, Susan, let me resend it to you. What's your last name?
Saker, S as in Sam, AECKER.
Great. As soon as we log off, give me about 3 minutes and I'll send it off to you.
Sounds good.
All right.
Awesome. Thanks, Susan.
Thanks so
Appreciate
much.
it.
Thank you.
All right.
Take care.
Enjoy. Have a good day.
Look
Bye-bye.
forward to it. Bye-bye.
Take care. Bye-bye.